Okay, I have a required announcement. Any citizen desiring to address the hospital board should turn in a speaker card for a board secretary. If the citizen comment pertains to items on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, the administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. So I'd like to call the meeting to order and ask for the approvals of the day. Can I have a motion, please?
Move. Second.
All those in favor respond by saying yes.
Yes.
Approved. The approval of the minutes of our meeting of September 20th. I'd ask for a motion. Do I have a second? Any corrections? Motion carries. Board reports. There are no board reports. We turn to medical staff reports, and we're going to ask Dr. Fiorica to start us off, if you would, please.
Yes, I would ask for a motion to approve the SMHCS organ and tissue donor procedure policy recommended by the Medical Executive Committee.
Second.
All those in favor respond by saying yes.
Yes.
Motion carries. Second is Dr. Jefferson, please.
Yes, I would ask for a motion to approve the SMH Venice Medical Staff Organization Manual as recommended by the Medical Executive Committee.
May I have a second, please?
Second.
All those in favor respond by saying yes. Opposed? Motion carries. Thank you, Doctor. Up next is our secretary, Sarah Lodge, please.
Our next meeting will be Monday, November 15th, 2021. From 9 a.m. to noon, we'll have our Governance Effective Committee. From noon to 12:30, we'll have our closed session hospital board meeting. From 12:30 to 2, our board lunch and hospital issues and financial review. And then from 2 to 4, our board meeting.
Thank you, Sarah. Treasurer's report. Joe, please.
Just one item. I move approval of the bad debt and charity care for the month ending September 30th, 2021 in the amount of $17,076,000.
I have a second, please. All those in favor respond by saying yes. Motion carries. Thank you, Joe. Financial highlights. Bill Fulton, our CFO. Bill.
Thank you, Mr. Chairman. Good afternoon, and I have the financial highlights for September. For this report, because we keep our books open longer in order to prepare for our annual audit, I'll only present the statistical results for September and the year to fiscal year to date. And actually, these are all fiscal year to date, so the whole of 2021. Starting with average daily occupancy, 659 patients per day compared to a budget of 595. The actual acute length of stay on average was 4.79 days. Last year it was 4.51 days. Admissions through fiscal 2021, we had 44,278 compared to a budget of 44,026. Surgery cases, 23,465 compared to a budget of 24,858. For births, we had 4,035 in fiscal 21 compared to a budget of 4,065. Our outpatient registrations totaled 491,542 compared to a budget of 477,504. And between our two emergency care centers, we had registrations of 117,064 compared to a budget of 121,757. Mr. Chairman, that concludes my report.
Thank you, Bill. Committee reports, Mission and Planning, Sharon Wetzler Peters, Chair.
Thank you, Mr. Chair. Earlier today, the Mission and Planning Committee met. After approving the minutes of the August 16, 2021, the committee considered several proposals related to the organization's growth. First, Lori Lang, Deborah Bohannon, and Amy Miller, Director of the Emergency Care Center, presented on the CT Expansion and Emergency Care Center renovation project. The project scope includes adding an additional CT scanner in the emergency room, as well as renovating the Emergency Care Center entrance and waiting room. Lori provided an update on SMH Sarasota growth. Debbie discussed radiology services growth, especially from the emergency care center volume, and highlighted the impact that trauma and stroke alerts have on radiology services, supporting the need for an additional CT scanner at SMH Sarasota. Amy discussed the related renovations to the ECC, which will improve efficiency, safety, and overall experience for patients and staff. Based on the foregoing, I move approval of the expenditure of an amount not to exceed $3,912,000 to construct 2 new CT suites, purchase 1 CT scanner, and renovate the entrance and waiting area of the ECC, which is budgeted in fiscal year 22 as recommended by the Mission and Planning Committee.
Second is given. All those in favor respond by saying yes.
Yes.
Opposed? Motion carries. Thank you. Continue, Sharon.
Comments.
I did what you said, Darrell.
Comments.
Okay.
Okay.
We should not be overrun.
Continue.
Okay, I'll continue. For the next presentation, Maria DiCarlo presented on the inpatient rehabilitation facility expansion. Marie recounted the scope of rehabilitation services and reminded the committee of the evolution of the rehabilitation pavilion. She then explained the proposed project plan for the inpatient rehabilitation expansion, which includes renovating 5 South to add 6 private inpatient rehabilitation rooms. The renovation is expected to be completed in 3 phases and will open for patient care in October of 2022. At this time, I move approval of the expenditure of an amount not to exceed $3,910,000 to renovate 5 South and add 6 rehabilitation patient bed rooms and corresponding support areas, as budgeted in fiscal year 22 and recommended by Mission and Planning Committee.
Do we have a second, please? All those in favor respond by saying yes.
Yes.
Opposed? Motion carries.
Opposed.
Okay, and the final presentation to the committee was by Sharon Roush for the rankings of the top 3 contractor and architectural firms for the Venice Hospital bed tower expansion. At this time, I move approval of the ranking of the general contractors and design teams for the SMH Venice Hospital bed tower expansion, as recommended by the Public Selection Committee and the Mission and Planning Committee. For the general contractor, number 1, Gilbane Building Company, 2, Grassfield and Gorey, 3, Bar & Bar. And for the design team, number 1, Flat Architects, 2, Grisham Smith, 3, TRO Jug Brennan.
Second, all those in favor respond by saying yes.
Yes.
Opposed? Motion
Question.
carries. Thank you, Sharon.
That ends my report, Mr. Chairman.
Thank you. Quality Committee.
Question, please.
Yes, Darrell, I'm sorry, go ahead.
Did Mr. Carter represent us on that selection team?
Yes.
Yes.
Yes,
Very well, thank you.
okay. Quality Committee, Dr. Raymar, Chair, please.
Yes, move approval of plans for provision of patient care services for SMH Sarasota and SMH Venice, as recommended by the Department.
All those in favor respond by saying yes.
Yes.
Opposed, motion carries. Thank you, Doctor. Up next is the President's Report. David Berenger, our President and Chief Executive Officer. David?
Thank you, Mr. Chairman. I'm going to start, like I do each month, with our organizational report card and look at the 5 areas of concentration that we have. The first being under service. We have our goal of having our likelihood of recommending our number of service there, 8 out of, our goal is having 8 out of 10 services at or greater than or equal to the 75th percentile. I'm happy to report that we came in and exceeded that for the year at 9 out of 10, and I'll show you the detail on that here in a minute. In the people area, we have our new hire retention, which is our percentage of regular full and part-time employees hired in FY 2001. They're still employed as of September 30th. We had our goal of being at 83% or higher. I'm happy to report we exceeded that goal and are at 88.86% for the year. In the quality section, we have our quality indicator is our infection prevention, which is our combined overall standardized infection rate, being less than 0.88. I'm happy to report that we did exceed that goal at 0.64. Just to remind the board that 1.0 would be the expected rate of the national average, so we're already setting our goal pretty low, and we continue to do very well in that area. Finance goal is our organizational finance operating margin being at or greater than budget at 5.5%. This bill is, Bill didn't show that this month, but I'll talk preliminarily that it's 10.7%. And finally, in growth, we have 2 goals. The first being our inpatient admissions and observation outpatients being at 51,164 or higher. I'm happy to report that we did come in higher than that, 52,439. And outpatient registrations had a goal of 977,000, and we exceeded that at 992,000. And I will say that we were underwater on that goal all year until this last quarter, so a lot of great work in the organization. Looking at the next page, we look at our patient experience report card. Far left is the likelihood of recommending each one of the 10 departments that we look at. In the middle is our FY21 score, which is where we ended up for the year. The first green column is the national median score, and then finally, far to the right is the 75th percentile score for each department. As you can tell, we made the national median score in all 10 categories, all 10 departments, and we made it 9 out of 10 at the 75th percentile. I do want to point out that all year we have struggled with our ER numbers in both the main campus and Northport. Both of those exceeded the 75th. We just dropped 1 point below on ambulatory surgery. So a lot of great work by Dr. Holland, Amy, and the rest of the team down there. Next up is our Gallup employee survey results. Has some really good news to mention in here. SMH achieved a top decile performance in the 2021 employee engagement survey, an especially noteworthy achievement during this ongoing pandemic. We did our survey just for the record over the summer, so right in the middle of Gallup reports that SMH is in the top 5% of all healthcare organizations. In fact, our grand mean scores and percentile rankings have increased each year we've completed a Gallup survey. This year, FY21, we ranked as follows. We had a 96% response rate compared to the Gallup average of 75. We had a grand mean of 4.36 versus the Gallup healthcare of 4.13. We had a percentile rank of 95 versus Gallup 75. And an engagement ratio of 11.3 to 1 versus the healthcare average in Gallup of 0.51. Pretty remarkable results by all leaders. Dr. Rehmeyer?
What does grand mean?
I know what it means, but I think I'm going to turn the microphone over to Lori Bennett, who can explain it in a better way. She's our executive director, or vice president of HR. Lori, aren't you behind me?
Yes, I
Okay.
Oh,
Yeah, the grand mean score is the average score out of a 5-point scale. I'm sorry, as for overall employee engagement, for all of the Gallup Q2 questions, that is the average score that, that we came in at 4.36, which means that we scored at the 95th percentile, which is absolutely incredible. And I think Gallup said that we were one of 2 or 3 clients this whole entire year that actually moved up in their survey results. So we're really proud of this score.
So just a little more color. Dr. Rehmeyer, it is, you have each question has a 1 to 5 answer, 5 being the highest score you can get. So when you add it all together, it's 4.336.
For measuring engagement, how
Right.
much more the employees feel they're involved and listened to and the whole lot.
That's exactly right.
Apply those perfectly. Everybody feels engaged.
Right. Oh, sure, we know what the questions are. There's 12 engagement score questions. We can pass them out at a later date so you can see them all. But they've been used for decades in Gallup, and they're used throughout all industries, and they're designed to show engagement of staff to an employee. It's not employee satisfaction, it's an employee engagement like this.
I know you see it.
We'll show that at a committee coming up.
Thank you.
Next slide is SMH named one of the world's most wired hospitals. SMH was ranked in the 98th percentile of healthcare facilities in the annual College of Healthcare Information Management Executives for the Time Digital Health Most Wired program. The honor was given for efforts to advance technologies promoting better and more secure patient interactions and care. More than 36,500 facilities were represented in the 2021 Chime survey. Sarasota Memorial was among 5 Florida hospitals and fewer than 100 to achieve the highest certification, level 9 and 10. This is the 3rd time we've received top honors, and telehealth is just one of many advances that SMH has used to receive this recognition. This is really Pam Ramhofer and her team, a huge success for their part. So if you see Pam, please congratulate her on that. City raises awareness for breast cancer and rehab. The city of Sarasota recently helped call attention to 2 special health recognition events: Rehab Rehabilitation Awareness Week and Breast Cancer Awareness Month. City officials issued a special proclamation for each observance with members of the rehab team below and right, and the Brian H. Ellison Cancer Institute below left on hand to accept. Many thanks to the city for recognizing those who are fighting breast cancer and efforts to help rehabilitation patients recover from illness and injury. Visitation, non-emergent surgeries resume. As the number of new COVID patients has decreased, Sarasota Memorial is easing several visitor restrictions. We know that seeing loved ones is so important for patients and families. We will continue to monitor COVID indicators and adjust visitor rules as needed in the weeks ahead. Our website has the current visitation guidelines, so please check that out. And also, we have resumed non-emergent surgeries that were paused during the recent surge in COVID patients. So, construction update for Sarasota Memorial Hospital in Venice. We have 100% inspections have been completed. The next would be October 21 to the 22nd, followed by an ACA licensure team and commission. And we remain scheduled to open in November 2021. Construction update on the Brian D. Jellison Cancer Institute Tower. The oncology tower construction is nearing completion. Final fixtures, furniture, and equipment installations are taking place throughout the next 2 weeks. Equipment testing and training is ongoing with end users. 100% inspection scheduled for October 25 and 26, and project remains scheduled to open in November 2021. And I said this earlier to the board, but I just want to make a comment for the public that is listening to this presentation. Pretty monumental that we have been able to bring these 2 projects in on time and under budget, or at least on budget. At any time, that's pretty monumental, particularly when you look at the fact that we've been 18 months in COVID now, all the supply chain distribution problems that have come up. And I know that Lori Lang and Sharon Roush are the heads of both these projects, and what they will tell you is that they manage a big team, and the whole team takes credit, but it's not without your leadership. If it wasn't for your leadership, we wouldn't be here today, and we all thank you as a community for doing that. And that is my report. I also said this earlier to the board, but I'm going to say it again since it's to the public. This will be the last time this board is meeting as a single hospital system. From now on, we're going to have a second hospital. So we only get to do that every 95 years or so. So we're looking forward to that. So thank you all. Thank you to the board members that have put up with this and really helped us get through this whole process and encourage us to do our best. It would not be here without your support. Thank you.
Thank you very much, David. Well said. Consent agenda. There's nothing on the consent agenda. Do we have anyone who wishes to speak or comment?
No, sir, we do not.
Thank you, Karen. Carol Ann Kalish, any legal matters?
I have no report.
I believe having completed our agenda, we now stand.
Hey, Mr. Chairman, I'd like to say something.
Go ahead.
Yeah, this is Tram Hudson. I wanted to say this at our earlier meeting, but a while back I had asked the board to consider opening up our committee meetings so that the citizens could either listen in virtually or to hear the discussion, when so much of what we do occurs in the committee meeting, not necessarily at this 2 o'clock meeting. And we really have not addressed that. So I would ask that at our next meeting, perhaps the Governance Affairs Committee, that we address opening up our committee meetings to the public to allow them to call in to hear the discussion on these important issues. Over.
With the exception of those meetings that are closed to the public? Is that
That is correct. Those that are closed to the public because of confidential issues, I understand. But I think for things like Commission and Planning, Investment Committee, Finance Committee, those meetings should be open to the public to participate virtually, particularly in this day and time.
We will bring it up at our next governance meeting. Thanks for raising it.
Thank you, Mr. Chairman.
Thank you all. We are adjourned.